which is inability to sleep, snoring and sleep apnea. 90 million people. That's almost a third of the population.
And of those treatment options, you don't ever really see, I mean, we see signs, you know, don't let friends drive drunk. We don't see signs that say don't let friends drive sleepy. And getting ready to come talk to you, I have a lot of friends in the law enforcement business, and a lot of them are highway patrolmen. And I found out from them that sleepy and tired drivers cause far more accidents than drunk drivers.
Right.
But yet we never see that addressed.
If you have sleep apnea, they will not give you a license to drive a motor vehicle.
If you have severe sleep apnea.
Severe sleep apnea. You have to be under treatment.
All right. Well, we're going to go into more of that when we come back. We're going to take a quick break, and then we'll get into that discussion. You're watching Medical News Network. I'm Mike Wittgenstein. We're in the studio with Dr. Rondeau. We'll be right back.
Mr. and Mrs. Jones, Sally's having some behavioral problems.
I guess that reward system isn't working.
Well, the timeouts weren't either.
You know, parents do find that timeouts aren't...
See?
Well, you're just too lenient.
Well, you're too strict.
No, you are.
Oh, you are.
No, you are.
No, you are.
When adults don't have the answers, they can feel as frustrated as kids. ConnectForKids.org has thousands of resources for helping kids in your community. ConnectForKids.org, guidance for grown-ups.
Welcome back. We're in studio with Dr. Rondeau talking about sleep apnea and TMJ, a condition that affects close to 90 million people in North America. All right, Doc, before we went to break, we were talking about sleep apnea in children, sleep apnea in adults. I mean, does it really have a particular person it affects? You told me you've treated children as young as 4 or 5 years old.
I think the big thing, Mike, is prevention. If we can prevent these problems with the children, then they'll never have sleep apnea and they'll never have TMJ problems. And so that's why I like using these functional appliances to bring the jaws forward. When you bring the jaw forward, you bring the tongue forward, open up the airway.
Okay, now I want to tell you, when I first started learning and I heard bring the jaw forward, I'm thinking, when I did research, there are doctors that do surgery to cut and move the jaw forward. It sounds like it is a very involved, painful process. But you're telling me there's basically no pain at all.
No pain at all. You wear an intraoral appliance, like 2 retainers that bring the jaw forward. It's very, very easy.
Now they wear those at night when they sleep?
Wear those at night when they sleep.
Okay, now show me again what it looks like, because I don't think people, this is for an adult.
First of all, there's about 90 different designs, but certain dentists have certain designs that they like the best. But this particular design, it's very simple. And you can see it's got a little hook hanging down here like this, and this hook under here, and that moves the jaw forward. And the jaw can't fall back at night.
And so if the jaw can't fall back, the tongue can't fall back, which keeps the airway open.
Absolutely. It's a very simple principle.
All right, now show me the one you did earlier for the children that most of the kids go in. You called this a twin block?
Twin block. This is a twin block appliance that also keeps the jaw forward. It's got 2 blocks that interlock at 70 degrees.
Now, can they open their mouth and close their mouth? I mean, because the little kids, obviously, if their mouth was stuck closed, would be probably a little claustrophobic.
They could open and close, but they only close in one spot, because if they put this block on top of that block,
it just makes it slide forward. And
they can't close. So they always bring the jaw forward, close like that, and they do that. If they wear that appliance for 7 months, the jaw stays forward, the tongue stays forward. They never have sleep apnea. But now the only other thing with children, you have to make sure that there's no large adenoids or tonsils. Get those tonsils and adenoids out. Now,
but if you went to the dentist, if they came to you, the mom and dad, and they brought their child in and you saw that, you would then refer them out to have the tonsils removed first.
That's correct.
Okay.
We work with the ear, nose, and throat specialist to do that.
Okay. The reason I really wanted to bring you on, was because obviously early prevention. But as you become an adult, and up until recently, obviously, you've told me oral appliances have been around, but they've not been used. It's my understanding that if you were diagnosed with sleep apnea by most medical physicians, went to a sleep lab, got your thing, from mild sleep apnea to severe sleep apnea, you ended up with this, which is a CPAP, right? A constant
That's correct.
Positive airway pressure, which basically is like a reverse vacuum cleaner. Instead of sucking in, it just constantly blows. I mean, if you look at this, and I'm going to talk to you about the numbers of people. You're hooked up to a hose. You're in bed. I mean, if you rolled over to your significant other or your husband or your wife, this is not the most romantic thing in the world. And I can't imagine it's very comfortable to sleep in. And you always have pressure blowing down your nose. People that have this, get it, need it, wear it. I have friends that have them. They don't wear them. how many people after a year are probably still using this?
Probably 80% of the people that are given that don't wear it after a year. The only ones that wear it are the ones that are really severe, when they're, say, 350 pounds and they've got big necks, and they absolutely have to have their airway opened up with that by blowing air up the nose. It blows out away the tongue and opens up the airway. Those patients need it.
Do you think there are people that don't go, and I'm going to tell you, I am one of them. You know, one of the reasons I want to talk to you is the ease of the appliance. You told me I probably have sleep apnea of some degree, and I do. I have a big neck, and I'm overweight, but I'm not wearing that. No. And I don't think I have it a severe case. I mean, obviously I could be okay with an appliance, but why do you think a lot of people, I mean, 90 million people is a lot of people, why do you think they don't go get checked? Do you think they're afraid they're going to get the CPAP machine?
Yes, I think it's a matter of education too. A lot of patients don't know that oral appliances will work. There's nobody really advertising that oral appliances will stop snoring and sleep apnea. That's one of the reasons I want to come on the program, to help educate patients, let them know that something can be done other than that. Most of my patients come in with that, and they say they can't wear it, and
right.
They want an alternative. They want to stop the snoring, they want to stop the sleep apnea, they want to stop the snoring because their wife is very upset. And actually, usually what happens is the wife drags the husband in kicking and screaming.
Okay, just to be fair, does sometime the husband drive the wife in kicking and screaming?
Once in a while.
Okay.
Women after menopause,
yes,
their fat sometimes goes to their neck, and they run into problems also.
Real quick, just because you said a woman with a neck circumference of greater than
16 inches
is
susceptible to sleep apnea.
And a man 17, did
more
you
than
say?
17, and I can see you're more than 17.
I'm a little more than 17 now. Okay, now I come in to get checked, to get started, to see if an oral appliance will help me, because obviously, you know, everybody's scared. They want to, you know, make sure nothing's going wrong. You brought a little appliance to show me that you give people to see if the oral appliance is going to help. Will you mind?
Yeah, sometimes we'll use a little temporary appliance.
Okay.
This is very inexpensive. Put a little temporary appliance in and see if that works.
The temporary holds the jaw forward with just that little paddle that sticks down.
Yes, the jaw fits in front of this little
and then if you have success with that, for those that weren't worried, then you move on into the other appliance.
That's right. That's one thing we can do. But some patients want to go right to the permanent appliance because they don't want to go to the temporary appliance.
As an adult, we've matured, we've grown. Can you still move the jaw? I mean, can you have success with that, or is it something that's, you know, once our jaw is in place, is it pretty much there? We're going to have to wear the appliance for the rest of our lives?
They'll probably have to wear the appliance the rest of their lives, just at night.
Just at night.
So
but
when
if
they
you
go to bed, they just put it in, they wake up in the morning and take it out.
But if you catch it as a child,
if you can prevent it, that's the thing. I mean, if you can get a child, usually, Mike, it's the patient with a jaw that's too far back. If you look at the profile, you'll see that the lower jaw is back. If that's the case, those patients need functional appliances when they're younger. I start with 5, 6, 7, 8, 9, 10, 11.
Can you literally move their jaw forward with them?
Absolutely, and it'll stay there. If you do it when they're actively
Because you see them, it comes down from their nose, you know, your lips, it's supposed to be kind of flat, but you see that chin that looks like it's, you know, it's gone away. You can literally cause that to move forward with an appliance.
Absolutely. I'm going to show you some pictures after that you won't believe.
Okay.
Case that I have treated.
All right, Doc, we have to take another quick break. When we come back, we're going to look at some of your cases, some before and afters, and just get a general idea of exactly what it is you're able to do with the appliances. You're watching Medical News Network. I'm Mike Wittgenstein. We're in studio with Dr. Rondeau. We'll be right back.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Welcome back. We're in studio with Dr. Brock Rondeau talking about sleep apnea and TMJ, and especially how it affects children. All right, Doc, before we went to break, we talked about